Continuing on with some of the factors that have significant influences in our mental health, our psychological health, we're still kind of on the self efficacy and self esteem aspects. In the context of positivity and negativity, these aspects are critical to our overall moods many of the times because look at the eternal optimist versus the eternal pessimist. The person who always feels like the glass is half full and the person who always feels as if somebody robbed them of half a Kool-Aid. You get into a mindset of overcoming obstacles, and that type of mindset has a much higher probability of not falling into a depressive state versus someone who is rightfully, maybe they have a very valid reason as to why they are feeling that type of sadness or discouragement. However, dwelling on those types of feelings and not learning how to kind of bring yourself out of that rut can have you going down a very negative and slippery slope of mental illness. And so these types of optimism versus positivity and negative thoughts are something we have to train our brains and our bodies to do because it's not natural for some people. And that's also just a part of your personality. That is just how some people are wired. Some people are just bubbly all the time. They can't have a bad day. They get on my nerves half the time because I don't understand how you can be positive in certain situations, but it actually is sometimes just an innate part of our personalities where people have an easier time with it, and you may be the person who has to really train and develop techniques to where you can learn optimism and practice that regularly. And all of these things, of course, you see the differences and changes as you go through these various age groups. So you don't have the same mindset and the psychological health as you did when you were 18, now that you are 35 or 45 or 55 or 85. Psychoneuroimmunology, and that is a handful to say, it's a mouthful. So we just kind of go with PNI. This is studying the brain and behavior and how these things have a direct influence on your immune system. There is a certain condition called fibromyalgia, and fibromyalgia has a variety of causes, and sometimes there is no cause. It's idiopathic. And because there is not always a defined reason for why people suffer from this disease, overwhelmingly women suffer from this disease, there has been a non-consensus within the medical community that stress and the way we deal with problems triggers the responses that our bodies have to pain, whether it be abnormal or not. And so this condition, certain medical conditions are triggered by stress. Stress makes them worse. Stress can increase blood pressure and respiration. And all of these things have a direct impact on how our bodies heal from diseases or become breeding grounds for diseases. So happiness, looking down from this, is also a subjective definition, but it's a collective term for how you embrace and how you react and feel about everything in general, how you feel about the world around you and how you feel about the people around you and your situations. Are you hopeful? Are you optimistic? Are you resentful? Do you carry and harbor contentment? Do you appear to be at risk for chronic diseases because you don't take care of yourself? Are you always frazzled? These are all things that encompass the mind-body connection and kind of filter into spirituality as well, and happiness, contentment, things of that nature. So we cannot discount the PNI's impact on how our bodies and our brains work as interdependent units to try and keep our bodies as healthy as possible. Now, because of that, we have to develop strategies in order to protect, preserve, and build up our psychological health. And some of these encompass developing a support system that can be your parents, that can be your family members, your friends, your school colleagues, your peers. This is just anyone who is going to help you rather than hinder you, making sure that you get things done, because a lack of completion for work assignments and school assignments, etc., can lead to stress, anxiety because of that procrastination. Being realistic, making sure you take time for you. And I have to be totally honest, the term self-care literally almost made me want to hurl. Part of that could be attributed to the people who were coming to me with this term, because I know that these people were selfish and already narcissistic. And that's just a subjective experience, but it did form my part of my definition for self-care, and I didn't too much care for it until people started coming to me and sharing with me their struggles, mainly physical struggles, and some of their psychological struggles. And for individuals who had psychological issues, because I'm not a trained therapist, I would just prescribe fitness regimens to them, small things, leisure and recreational types of activities, and their psychological health was enhanced because of that. And I therefore had to take a second look at what that term self-care really means. It's not a selfish term. It can seem selfish if you are the type of person who is continuously giving and giving and giving from an empty reservoir. You can maybe feel a sense of guilt or selfishness, but if you do not take time for your own self-care, then you're going to have to take time for your illness. So this time that you spend, whether it's getting your nails done, having dinner away from your kids, because it's important to spend some time away from your kids and your spouse and evaluate you as a human being, as an individual person, not as something to someone else. These things will enhance your self-efficacy, your self-esteem. They will rejuvenate you, and it's very important. That has a direct impact on your physical health, because at the bottom of Maslow's tier, we saw exercise, and people don't do that. So it's not just about the self-care in the form of leisure, recreation, relaxation, rejuvenation, but also self-care, making sure that our bodies are healthy, because the brain and the body are interdependent entities. And if you neglect one, the other will suffer, not if, will suffer. And there is a book called The Body Keeps Score, and I believe it's written by a neurophysicist. Your body literally keeps track of everything from trauma to bad eating habits to bad sleeping habits. And you can train your body to have a positive reaction or a negative reaction. Your body keeps score. You don't suddenly develop atherosclerosis at the age of 50. You have been tearing your body apart and eating unhealthy. At the age of 50, now you can't fight it off like you did at 25 when you were invincible. Same thing with a cavity. You don't have a cavity when you say, ow. The cavity has been there. You just felt it now that it got to the root. So we have to also do the same thing with our physical and our mental health, making sure that we are working just staunchly to protect and build and enhance these aspects. And getting some sleep. I struggle with that. I'm a very poor sleeper. And so these are some of the aspects that not only will really help us, and I'm going to skip over PERMA, by the way, because that's just something you guys can read on your own, but these aspects truly will not only help us deal with our current issues, but they will help us prevent things in the past and or develop strategies to cope with life struggles more efficiently. And so when your health deteriorates, which we hope doesn't happen, but we prepare for the worst and hope for the best, when your psychological health deteriorates, then relationships suffer. You become stressed. Your blood pressure is going up. You can feel higher anxiety. You can spend more money than you have. You can binge eat. There are just This is customized to the individual because it looks different. And these are some of the reasons why mental illness is hard to spot sometimes, but there are some telltale characteristics. And looking at college students, it's not as uncommon as you might think. There has been a negative stigma attached to mental health and getting help, so much so that people feel that they're crazy if they don't get help because they'll be ridiculed. When the reality is that we're all probably a little bit crazy, and our crazy just looks different from other people. So just like if you would break your arm or your leg, you wouldn't say, go pray it off or go sleep it off or go put some ice on it. There's a doctor for that. And there are doctors for your mind and your in your spirituality when it goes down, and your emotional aspects when it goes down, and your social interactions and effective feelings toward other people when those are malfunctioning. So we can get help, and it's nothing to be ashamed of. It's very common among college students because college is a stressful environment, especially now because everything is online. We're dealing with glitches, some of the stuff I didn't know about, Zoom links aren't working, internet is slow. It's stressful for me. I know it's stressful for you guys. And we do have mental health counselors at Pierce College. They're doing online sessions for free. I want to say that you can get 6 sessions. As of last year, I want to say that they gave you 6 sessions for free. And these are not from individuals who are poorly trained. These are individuals who have graduate degrees and are working on their doctorates. So you will be seen by a quality healthcare professional. And they can treat a variety of issues. ADD and ADHD, poorly understood, oftentimes undiagnosed, and people concentrate on the hyperactive part of ADD or ADHD. But ADD is an attention deficit disorder, not always coinciding with hyperactivity. There are students who just don't pay attention. They zone out and they're not problem kids. And we don't know because they've never been properly diagnosed or evaluated. And that has a huge implication for college students. And so these are not issues that you should be ashamed to get help for. These are issues that will actually enhance your collegiate experience and lower your stress levels. And look at these numbers in the past year, and these are fairly recent data. 86% of college students are just feeling the heat is too much. It's just too much. That's a lot. That's over 3/4 of college students that are feeling overwhelmed, because now college students don't just look like 18 to 22. Now college students look like 15, 16. I have high school students in some of my college classes. We have older adult learners who are going back to school. We have people who are reevaluating what their life's purpose is, because they have come to a better understanding of their spiritual health, and now they're wanting to get into their purpose, and they come back to school. And so they feel overwhelmed because now they're juggling family, changing life trajectory. You might have had a baby. Maybe you can't afford books. Maybe you are food or housing insecure. Maybe you don't feel a sense of belonging. All of these things contribute to the fact that you are overwhelmed. And then we add on exams and online work environments and some people who don't care about your education and long financial aid lines. Just one or two of those in and of itself is enough to crack some people. And there are those of you guys who are dealing with 4 and 5 and 6 of these issues, and you're still showing up. So, our abilities to push forward are amazing, but your body will keep score, and eventually we'll have to deal with those problems. Hopelessness, over half of y'all, college students in general, these are huge problems that need to be addressed. So the stigma, if 1 out of 2 college students are feeling hopeless and 3/4 plus of them are feeling overwhelmed, why is there a stigma attached to it? Because people are so concerned about how they will look to someone else. Y'all need to get the help that you need. You should not be willing to go down in flames just to look good for someone else who definitely would not do the same thing for you. So use the resources that we have at Pierce and the LACCD. And I know LA County has quite a bit of resources for mental health disorders. These are just a list of some of them. These are actually all forms of depression. And I won't go over them in detail because I want to make sure that I cover some of the other aspects of the chapter. So I do want you guys to study about these. We know quite a few of the symptoms: lethargy, not having a zest for life, being disinterested in activities that you used to be interested in, skipping school or work to sleep, overeating, not eating. All of these things can be symptoms of depression. And so please do go over these on your own in the book. Make sure you read the material, because the slideshow is really just a supplement of the book. It's not going to cover everything intently. So you do have to study on your own. And I'm going to skip over this because I want to get to anxiety. Now, anxiety and depression are often found in tandem, and not always, but often. Just like chlamydia and gonorrhea, they tend to treat those at the same time. So anxiety, and these are illnesses if you tend to be a worrywart, you may have an issue with anxiety. And not just worrying about a test or a final, but everyday basic things that the normal person should be able to handle with a degree of calmness, that eustress, not the distress. And anxiety disorders are the #1 mental health issue in the United States. #1, and depression is often found in conjunction with that as well.